All right, let's dive in today into something pretty fascinating, the potential of cannabis in maybe even preventing or managing Alzheimer's disease.
It's really interesting.
We're going to be looking at some of the latest insights from the BudMed Bulletin, a medical cannabis newsletter.
Yeah, sounds good.
So Alzheimer's is the most common cause of dementia, right?
It is, yeah. It impacts a lot of people.
Affecting something like 60 to 80% of all dementia cases.
Wow.
It's a disease that, progressively affects memory and cognitive function.
Okay.
So let's start with this idea of cannabis maybe acting as a shield against Alzheimer's.
Yeah. So one of the key things here is neuroprotection.
Okay.
And that is the ability of a substance to protect brain cells from damage.
Got it.
And there's some research that suggests certain cannabinoids, especially CBD and THC, might have these neuroprotective properties.
So CBD, which is the non-psychoactive part of cannabis, has already shown promise in treating epilepsy.
Right.
And that kind of suggests it's got some pretty strong brain protecting potential.
Oh, absolutely.
Yeah.
Yes, studies are indicating that CBD might have broader implications for brain health than we initially thought.
Interesting.
Yeah, it seems to interact with a whole bunch of different pathways in the brain,
Oh, wow.
potentially reducing inflammation and protecting those neurons from damage.
So what about THC then? What's its role in this?
THC, the psychoactive part, has shown some really interesting results when it comes to potentially protecting against what's called amyloid beta toxicity.
Okay.
And this is a big one because amyloid beta plaques are kind of a hallmark of Alzheimer's disease.
Right.
They form when these amyloid beta proteins clump together.
Uh-huh.
And basically, they disrupt the communication between brain cells and can eventually lead to cell death.
So THC could potentially interfere with that whole process?
Well, there's evidence that suggests that it might interfere with the formation of these plaques
Wow.
or even help clear them out.
Okay.
It's still early days in terms of the research,
Uh-huh.
but it's super intriguing for sure.
Yeah, so it's like having two different defenders on your brain's team,
Right.
each with their own special strategy for protecting those vulnerable cells.
Yeah.
And this type of protection is even more important as we age, right?
Yeah, exactly.
Especially since, Alzheimer's is something that primarily affects older adults.
Precisely. As we get older, our brains just naturally become a bit more vulnerable to damage and decline.
Makes sense.
So the idea that cannabis might actually offer some level of protection against that is pretty compelling.
It is compelling. So let's shift gears a little bit here
Right.
and talk about how cannabis might help manage the symptoms of Alzheimer's that already exist.
Yeah, because those can be some of the toughest things to deal with
They are.
for both the patient and their loved ones.
Absolutely.
Mm.
So there's some promising research suggesting that cannabis can be a pretty safe and effective way to manage some of those behavioral and psychological symptoms of dementia, right?
Yeah.
Including things like agitation and anxiety, even sleep disturbances.
It's huge, honestly, because you think about the relief it could offer, not just for the patients themselves, but for their caregivers.
Exactly. It's
Yeah.
a big deal. And these symptoms are incredibly difficult to manage, so anything that can provide any kind of relief, it's potentially life-changing.
Right, absolutely.
Huh.
Imagine the difference it could make for both the patient and their family if we could just reduce some of those difficult behaviors,
Yeah,
and improve their overall quality of life.
I agree. Okay, this brings us to something that I will fully admit I don't fully understand, the endocannabinoid system.
Okay.
Can you give us a quick rundown on that?
Sure. So the endocannabinoid system, we'll just call it the ECS, is a really complex network of receptors and neurotransmitters.
Mhm.
And these are found throughout the body, including the brain.
Got it.
And it plays a crucial role in maintaining something called homeostasis,
Homeostasis meaning
keeping
that.
everything balanced,
Oh, no. Okay.
functioning properly.
Yeah.
So how does cannabis come in? Well, cannabinoids, like our friends CBD and THC, they bind to those receptors in the ECS.
Okay.
And that influences a whole bunch of physiological processes,
Okay.
including things like mood, sleep, appetite, even your immune function.
Wow, so that's why cannabis could potentially have such a positive impact on mood disorders and other symptoms that are often seen with Alzheimer's.
Exactly, because that ECS is involved in regulating so many different functions.
Right.
Using cannabinoids to modulate it could potentially help alleviate a really wide range of symptoms,
Oh, got it.
not just in Alzheimer's, but in other conditions too.
That's fascinating. So to help us understand all of this even better,
Sure.
can you tell us a bit about Lucy?
Of course. So Lucy is an Alzheimer's patient whose story is a great example of the potential for symptom relief using cannabis.
Okay.
Now, every case is different, obviously. We're not going to get into the specifics of her medical history or anything like that.
Yeah.
But she really did experience some notable improvements in her symptoms.
I think stories like Lucy's are so important because they bring this human element to what can sometimes feel like a very cold scientific discussion.
Yeah, definitely.
It reminds us that we're not just talking about cells and chemicals and things.
Right.
We're talking about real people and what they're going through.
Exactly.
Yeah.
And while anecdotal evidence like Lucy's story,
Hmm.
it shouldn't be taken as like conclusive proof or anything.
Of course.
It's definitely compelling.
Right.
And it tells us that it warrants further investigation.
Definitely. And that brings us to maybe the most intriguing aspect of all of this.
Yeah.
This idea that cannabis could actually prevent or delay the onset of Alzheimer's altogether.
That would be incredible.
That would be a game changer.
Right.
Where does the research stand on that?
Well, there's a growing body of research suggesting that it actually might have that preventative potential.
Wow.
And one of the key figures in this area is a guy named Dr. Gary Wenk
Okay.
from Ohio State University.
Uh-huh.
His research focuses specifically on the link between cannabis compounds and brain inflammation.
So we've talked about neuroprotection, but what's the connection to inflammation?
Right. So chronic inflammation in the brain, it's actually considered a major contributing factor to how Alzheimer's develops and progresses.
Got it.
Think of it like a slow-burning fire in your brain that gradually damages brain cells over time.
Okay, I'm starting to see the connection here. So those neuroprotective effects of CBD and THC we were talking about earlier,
Yeah.
could they actually be working by reducing that inflammation in the brain?
That's exactly it. CBD in particular has been shown to interact with very specific pathways in the brain that are involved in regulating inflammation.
Okay.
It can actually inhibit the production of these pro-inflammatory molecules
Wow.
and even promote the release of anti-inflammatory ones.
So it's like CBD is helping to put out those inflammatory fires before they can cause too much damage.
Yeah, that's a great way to think about it.
I like that.
And then THC, although it's got a different mechanism of action,
Yeah.
also seems to have some anti-inflammatory properties.
Okay, so are we talking about completely preventing Alzheimer's, or is it more about delaying the onset?
That's the million-dollar question.
Right.
We need a lot more research to really know the full extent of that preventative potential.
Right.
But even if it could delay the onset by a few years,
Yeah.
think about the massive impact that would have on individuals and on healthcare systems all over the world.
That's true. But we need some hard evidence here.
Of course.
What kind of studies have actually been done to back up these claims?
Well, one study that's really interesting, published in Neuroscience, looked at recreational cannabis users.
Okay.
And they found a pretty remarkable statistic. They had a 96% lower chance of experiencing subjective cognitive decline compared to those who didn't use cannabis.
Wait, 96%?
Yeah.
That's a massive difference. Is that typical of the research out there?
It's definitely one of the more striking findings.
Yeah.
Other studies have shown some positive correlations between using cannabis and cognitive function in older adults. But it's really important to remember, correlation doesn't automatically mean causation.
Of course.
So more research is needed to really nail down those exact mechanisms that are involved.
Right. But even with that in mind, those findings are pretty exciting.
They are.
Yeah.
And they raise so many intriguing questions. If cannabis really can protect our brains from cognitive decline, what does that mean for how we approach Alzheimer's prevention?
That's where I think it gets really interesting.
Yeah.
What does all this mean for someone listening right now who's maybe concerned about their own brain health?
Right.
Or has a family history of Alzheimer's? What should they take away from all of this?
Well, first and foremost, we got to emphasize that cannabis is not a magic bullet.
Of course.
We're still early in the research.
Right.
We have to be cautious about making any definitive claims.
Yeah, and it's definitely not a do-it-yourself situation.
Exactly.
Anyone thinking about using cannabis, for themselves or a loved one with Alzheimer's, they really should consult with a healthcare professional.
Absolutely. There are so many factors to consider, like their individual medical history,
Yeah.
any potential drug interactions,
Yeah.
and the specific type and dosage of cannabis that might be appropriate for them.
Right.
A doctor can help assess the potential benefits and risks
Mm-hmm.
and guide patients towards making more informed decisions.
That makes a lot of sense. So where do we go from here then? What's the next step?
Well, the most important thing is continuing that research.
Yeah.
We need more of those large-scale clinical trials to really understand those long-term effects of cannabis on brain health and cognitive function,
Right.
especially how it relates to Alzheimer's disease.
I can't help but feel like we're on the verge of something really groundbreaking here.
I know, right?
Imagine a future where cannabis isn't just seen as a recreational drug, but as a legitimate tool for fighting this devastating disease.
That's a future worth fighting for, that's for sure.
Yeah. Think about the impact this could have on individuals and their families.
Right.
And healthcare systems all over the world. If we can find safe and effective ways to prevent or even delay the onset of Alzheimer's, the implications are just huge.
Absolutely massive.
All right, let's take a moment to kind of recap what we've covered so far in this deep dive.
Okay.
We started by exploring the potential of cannabis to protect brain cells from damage.
Right, with the neuroprotective properties of those key cannabinoids, CBD and THC.
Exactly. Then we talked about how cannabis might help manage some of those more challenging symptoms of Alzheimer's.
The agitation, anxiety, all of that.
Yeah, offering some much-needed relief for both patients and caregivers.
Right.
And then we delved into this really fascinating idea of cannabis actually preventing or delaying the onset of Alzheimer's altogether.
Yeah, that was a big one.
Looking at the role of brain inflammation and the potential for cannabis to combat that.
Yeah, definitely.
And of course, we emphasized the need for more research, always.
Always.
And the importance of talking to healthcare professionals before making any decisions about cannabis use.
Right.
And even with all that said, I still have some questions.
Oh, I'm sure. Yeah.
This whole exploration has definitely left me wondering about a few things.
I bet.
Like, if the research keeps going down this path and shows that, yeah, this is a good thing, how could this, totally change how we approach Alzheimer's care and prevention?
It's a really big question.
Yeah.
And it's one that, researchers, doctors, they're already thinking about this a lot.
Yeah.
We might see a huge shift, from just dealing with the symptoms after the disease has already started to being more proactive, trying to stop it before it even begins.
So we're talking about a potential paradigm shift here.
Yeah, exactly.
And how we even think about and treat Alzheimer's.
Totally. Think about it, a future where, preventative measures, potentially even using cannabis-based therapies, become standard care for people who might be at risk.
That would be incredible.
Right.
What about the social implications? Could this mean we see less stigma around cannabis?
Oh, I think so.
Especially if it starts to be recognized as a real medical treatment for Alzheimer's?
Absolutely. We've already seen how public opinion has started to shift, right?
Yeah.
As we learn more about the medical benefits.
Right.
So this could really accelerate that trend, I think.
Yeah.
Lead to more open discussions about it,
For sure.
Less fear around cannabis use.
What about the pharmaceutical industry? Could this lead to a whole wave of new medications specifically designed to target Alzheimer's, but using cannabis?
Definitely. It's an area where there's a ton of investment and research happening right now.
Yeah.
As we understand more about the endocannabinoid system and how it all plays into Alzheimer's, we could see an explosion of new therapies that use those specific properties of cannabinoids to target different parts of the disease.
The ripple effects are pretty mind-blowing, honestly.
Yeah.
This isn't just about one plant and one disease.
Right.
It's potentially about a transformation in how we approach healthcare and even just our understanding of the brain itself.
Got it. And you know what? We've only scratched the surface here. This is a really vast, complex topic.
It is.
But this deep dive, I think it shows the incredible potential of cannabis to not just improve people's lives, but to really reshape how we think about brain health altogether.
So for everyone listening, here's something to think about.
Yeah?
If cannabis does turn out to be a really powerful tool in the fight against Alzheimer's, what could that mean for you?
Right.
For your family, your loved ones, for society as a whole?
It's a big question. No easy answers.
Yeah.
But it's definitely a conversation worth having.
It is. I think the future of Alzheimer's care could be really closely tied to the future of cannabis research.
I think so, too.
And that's something that we should all be paying attention to.
Absolutely.
Well, thanks for joining us for this deep dive into the world of cannabis and Alzheimer's.
Yeah, it's been fascinating.
It has. It's been a really interesting journey, and I'm so curious to see where it leads.
Me too.
Until next time, everybody keep those brains engaged and never stop asking questions.
Never stop questioning. That's right.
The search for knowledge never ends. Who knows what amazing discoveries are waiting for us just around the corner?
Exactly.
If the research keeps going and shows good results, how could that reshape how we approach Alzheimer's care and prevention?
Well, researchers and doctors are already trying to figure that out.
Yeah.
I mean, we might see a huge shift from mainly just managing symptoms to a more proactive approach, like trying to stop it before it even happens.
So we're talking about a whole new way of thinking about and treating Alzheimer's.
Yeah, exactly.
Okay.
Imagine preventative measures, maybe even using cannabis, becoming standard care for people who are at risk.
That would be revolutionary. What about like the social side of things?
Yeah.
Could this mean less stigma around cannabis in general?
Oh, I think it's very possible.
Especially if it's seen as a real treatment for Alzheimer's.
Yeah, I mean, we've already seen a change in how people think about it
Right.
as we learn more about its medical uses.
Right.
So this could really speed that up,
Yeah.
More open conversations.
Yeah, for sure. What about big pharma?
Oh, yeah.
Could this lead to a ton of new cannabis-based medications specifically for Alzheimer's?
It's definitely attracting a lot of attention and research right now.
Yeah.
As we understand more about the endocannabinoid system and its role in Alzheimer's,
Mm-hmm.
we could see a wave of new therapies
Okay.
that are designed to use the specific benefits of cannabinoids to target different parts of the disease.
Wow, it's kind of mind-blowing to think about the possibilities.
It is, yeah.
It's not just about this plant and this one disease.
Right.
It could change healthcare and how we understand the brain as a whole.
You're absolutely right. And this deep dive, it's just the tip of the iceberg. Really,
Right.
this is a huge topic.
Yeah, it is.
But I think it shows just how much potential cannabis has,
Yeah.
not just to help people live better lives,
Uh-huh.
but to really change how we think about brain health in general.
So for everyone listening, here's something to think about. If cannabis really does turn out to be a major player in the fight against Alzheimer's,
Right.
what could that mean for you, for your family, for our society?
That's a big question, and there are no easy answers.
Yeah.
But it's a conversation we need to have.
It is. It seems like the future of Alzheimer's care is going to be very connected to the future of cannabis research.
I think so, too.
And that's something we should all be thinking about.
For sure.
Well, that's all the time we have for today, but thanks for joining us for this deep dive into the world of cannabis and Alzheimer's.
Yeah, thanks for having me.
It's been a fascinating journey, and I can't wait to see what happens next.
Me too.
Thanks for listening, everyone. Keep those brains engaged and never stop asking questions.
That's right. Never stop questioning.
The search for knowledge is never over, and who knows what amazing discoveries are just around the corner.
Exactly.